Hello, my beautiful acupuncture colleagues and friends. I am Dr. Charlene Lawrence, and I am the founder of the Hypnopuncture Method. I want to send you this quick little video to give you a simple leg up in your treatment room. This is a communication style with NLP, Neuro-Linguistics Programming, and this is a technique that I use not only with my patients in the treatment room all day, every day, but everybody I meet. And so I want you to start practicing this technique with your patients, with your loved ones, and really just keep an eye out for where their eye patterns are going so that you can absolutely feed back information into their speaking style. Everybody has something called an internal representation. And each person falls on some scale between 4 areas of thinking and speech and internal communication. That is visual, auditory, kinesthetic, and auditory digital. Now, this is information that I teach in depth in my Hypnopuncture online course, and I'm going to share the basics with you here today. I believe I have my camera set up correctly so that you will be able to see me as if I am the patient sitting right in front of you. I am also going to be very demonstrative with my eye patterns and know that some people are just naturally demonstrative and others are very subtle. So you will hone in this skill over time as you practice more and more. So when their eyes flick up and to your left, remember, your left, their right, when their eyes flick up and to your left, that person is going into a visual space. This is visual construct, meaning that they are visually constructing something in their mind. If I asked you to imagine a purple unicorn with pink polka dots, you would probably flick your eyes up and to your left if you were watching yourself in a mirror. And that's because you would be constructing what that purple unicorn with pink polka dots looks like. Now, just below that, if they go directly lateral and to your left, the patient's right, your left, as you look at them, if they go directly lateral, they are actually tapping into where their ears are. So this is auditory construct. Again, they are constructing what something may sound like. Now let's head over to the other side. So as you are looking at the patient, so up and to your right, they are visually recalling something. So up and to the right is visual recall. Again, you looking straight onto the patient. I don't know if you have the same problem like I do. I am always mirroring people, so I know where their left and right are, but I cannot remember where mine are. So if they go up and to your right, that is visual recall. They are imagining what something looked like that they have seen before. Now, on the flip side, just like we did auditory construct, if they go directly lateral, they are tapping into the ear. So directly lateral into your right is going to be auditory recall. They are remembering what something sounded like. Now, we have the two oddballs. So, as you are facing the patient, if they go down and to your right, so they are looking down this way, that is what we call auditory digital. This is self-talk. These people are thinking about something. So I imagine if you ask somebody to think about what 12 times 12 is, and they had to actually do the math in their head, they might be looking down and to your right because they're talking to themselves. They are thinking about it. And then that last one, if they are looking down and to your left, down and to your left, This is the kinesthetic space. So this means that that person is tapping into not only what they may be able to feel on their skin, but also any emotions they may have felt about what they're recalling or they may feel in the moment. Now, here's how you use this little tool. If your patient is talking to you and their eyes are constantly flicking in this upper space, they're very visual. So you want to use visual words like look, see, imagine, picture. Those are very visual terms. If their eyes are bouncing back and forth, going laterally, again, trying to be demonstrative here, they are probably very auditory. So you want to use words like sound good. Are you listening? Listen, I've got something important to tell you. You want to tap into those auditory words as you're communicating. Now, if that person happens to go down into that auditory digital, that really thinker self-talk space, you're going to want to make sense to them. They are going to need to understand you. So you're going to want to use those understand, make sense, thinking type words. And then finally, if they're going into that kinesthetic space, they are looking down and to your left, that kinesthetic space, then that means that they are feelers. You can use those emotional words. You can talk to them about feeling. How does that feel? Does that feel good to you? Can you grasp what I'm telling you? Anything that's going to be a very powerful kinesthetic word. So I want you to start using this tool with the people you interact with and really pay attention to where their eye patterns go. Remember, some people are very demonstrative with their eye patterns. Some people are very subtle. And again, this is all great stuff that I teach in my hypnopuncture online courses. I hope you got a lot of value out of this video today. Don't forget, I do have the quick little PDF that shows you exactly what it looks like. And I hope to see you again soon.